Okay, this is lecture 29 for Wednesday, April 9th. The last one ended rather abruptly. I forgot to put an ending slide in there, but we should be able to get through this as well. That one ran a little longer than I wanted to. Hopefully this one won't run quite as long, so it averages out. I'm speaking a little faster in these videos, so they should be shorter than the full 50-minute class because we're not having interaction, we're not having discussion. So again, we got a YouTube lecture for Monday, a YouTube lecture for Wednesday, review session Thursday, exam this Friday the 11th, same information. Here are the lectures that it's on, multiple choice matching sequences, as much time as you need. So again, we're going to get a lot of the nervous system done, probably not all of it. Exam 2, and then we'll finish up nervous system endocrine in week 11. So we're thinking about signals in the nervous system. We have to think about the direction things are flowing. So we have the nervous system kind of figuring out the environment around it. So you're going to have sensory input. So a receptor or a sensory neuron is going to send information to the central nervous system. This is an afferent nerve going into the central nervous system. And once in the central nervous system, you're going to have all those parts of the brain and spinal cord make some decisions. Once they make those decisions, they are going to send out a response in a motor output, a motor neuron, efferent. So A becomes before E, efferent, the central nervous system to the muscle or whatever we have sending things out. So muscle is voluntary. We also have an involuntary system or autonomic system that we'll talk about. So central nervous system, we talked about this already. You've got the central nervous system with the brain and spinal cord. You've got the peripheral nervous system. You've got things that are sensing the environment and then sending a response from the central nervous system. You've got cranial nerves coming out from the bottom of the brain throughout the face. You have spinal nerves going to come either out of the side there. We're talking about motor neurons or sensory neurons. You're going to have internal and external. Internal is going to sense what you are doing in your body. External is your senses perceiving the world around you, so outside the body. So external response, so the eyes, smell, taste, touch, vibrations all come from outside the body, and we take those in and try to interpret the world around us. The internal, we have, how's my heart doing? What's my gut doing? What are my legs doing? Where is my, how am I positioned? So we should be able to close our eyes, put our hand somewhere, and then we open up, we know where that hand is. So we have a lot of different things perceiving. So all that's coming into the central nervous system. Then we have our motor or efferent. We have a voluntary side and an involuntary side. Voluntary goes to the skeletal muscle. So you have conscious and reflex movements, so things we don't think too much about but still get done. And then you've got trained responses and motor skills that are laying out in one way or another. We also have involuntary responses. These are part of the autonomic system. And then we have sympathetic and parasympathetic responses. So this is from Mr. Dr. Day when he taught here before he retired. This was a real nice chart here showing how the central nervous system is organized. So we have the sensory input going up the afferent. It goes into the central or peripheral nervous system. It's going to go up into the central nervous system where it's integrated, and it's going to come back down the peripheral nervous system and out to the body again. So the problem with this part here is it implies a circle, but it's not. We just go up to the central nervous system and then come down the other side. They don't cross back. If we're looking at sensory, we have the internal and external that we talked about. We also have branching off the central nervous system, the hypothalamus, the pituitary. We've got the endocrine system gets its start. So we can think of the nervous system as very quick. The endocrine system is more long-term. Coming out of the central nervous system back to the peripheral nervous, we're going to be in the efferent side of things that are leaving the central nervous system going out to the body. We have, they're called motor neurons. We have involuntary and voluntary. And then we can split the involuntary up into parasympathetic and sympathetic. So this is a real nice diagram. Take some time to study it, get used to it, moving through. And as we said before, you got to call that split in there, that you're going up one side, coming down the other. You can't go back this way. You can't go across there. You're going up and then down. So that's all the way the signals go. So we can look about how that happens. We've got the dorsal root, the sensory nerves coming in. We got the motor neurons going out. So sensing things and then sending those up in. We go in the dorsal root and come out the ventral root. So afferent going up on the top side of the spinal cord, and then the motor neurons coming out the bottom part of the spinal cord. Same thing here. You can sort of see the arrows showing the direction things are going in. So we come in the dorsal root, go out the ventral root. So motor nerve down here. We have a sensory neuron or afferent, and motor or efferent. So sensory nerve comes in. We have an intermediate neuron, synapses where these things are. So this is the axon on a sensory. We've got the connection between the two, intermediate neuron, and then we've got a synapse, and then we've got dendrites, body, axon of a motor neuron sending information back out. Same thing again. We have some sort of pain receptor in here that's going to come in through the spinal cord. If we've got a reflex that says, hey, we need to pull that thing away, especially for heat and things like that, it's going to go right back out and activate a muscle to pull that hand away. If something's hot, when we touch it with our hand, our sensory nerve there, or something hurts, we sometimes pull our hand back faster than we realize what's happening. And that's because of reflexes. So the signal comes in here, it's going to send one direction back out to the motor neuron, tell you, pull your hand away, or don't step on that, or something. And then another route or direction is going to send the signal up to the brain and then tell you what happened. So sometimes we pulled our hand away or lifted up our foot even before our brain has acknowledged what's happening. So we'll talk about reflexes in a minute. So again, a good cross section here. Let's see, where's the dorsal? Dorsal horns are one. Guessing they're up top. Yep, dorsal here. And then the ventral coming out there. So atlas of equine anatomy. So you've got a lot of receptors depending on where we are in the body. They're going to be in these areas. The bodies of those nerves are going to be in this ganglia that sit on either side of the spinal cord, and you're going to have your dendrites or your sensory ends way out wherever they're needed, and then you got your bodies here, and that signal is going to run that axon into the dorsal horn, and then all these different directions are going to be established to move through. So we mentioned the sensory or afferent nerves. The internal says, what am I doing? Is my heart beating? Is my lungs breathing? Am I getting enough CO2? Am I getting enough oxygen? How does my gut feel? It's measuring the status. Do I feel cold? All those things. So internally, inside the skin, what am I doing? How am I doing? Do I need to make adjustments? And then there's the external sensory or afferent. You're thinking about the senses. What's going on around me? What's going on outside my skin? So how do I perceive the world? How do I understand the world around me? When we're looking at our motor or efferent side, we've got the voluntary, which is also called somatic. So we can think of the body, soma meaning body. It's going to control the skeletal muscle, and this is the stuff we tend to think about. I want to walk over there. I need to run fast. I need to lift this up and put it in the car. Those are all things we kind of think about. We don't maybe think about all the details because of patterning and things like that. I want to walk over there. I don't have to do all the complex thinking. I got to move this muscle and this muscle and this muscle and this muscle. I'm just thinking I'm going to walk, and the lower brain takes care of all the things that need to be taken care of. The involuntary motor or efferent is called the autonomic. These are the things we do without thinking. So you're thinking about controlling the smooth muscle. You're thinking about controlling organs or different areas going through. So it's the stuff we don't think about, but it's important that the brain still be in control of it. We can look at it this way. So we've got a peripheral nervous system here, peripheral nervous system here. So you got PNS for these two arrows, and then the central nervous system, we've got the integration. So sensory, we're seeing things with our eye, and then that is sent to the central nervous system, decides what to do with that information, and says, oh, I see a very large hungry creature that is chasing me. I'm going to send motor output to run very fast. So note that while the sensory is one continuous chain to the motor, there's no connection between these two. We have the eye still perceiving the world around you, trying to decide if that is still a threat, and it will continue to send in sensory input that the brain will adjust to, but it's not a closed loop. You're just going around, and then you're watching, okay, I started running, what's happening now? And then the senses again will take inventory and make decisions. So continually adjusting, continually figuring things out. So we'll try to do the demonstration I just went by in class there. So this is a classic case of probably about as short a nervous impulse as you can deal with. You have a stretch receptor that are usually located near the tendons, and we've got that nerve going in to here, and then we have a motor neuron going in. So we're barely getting into the central nervous system, but we are there, and then going back out. So this is the components of a reflex arc. You have the stretch receptor measuring how much tension or how much pull is on our I'm losing my battery here. Okay, it appears to be working. Okay, so we've got the stretch receptor figuring how much tension. Anytime there's a pull on that, the stretch receptor senses that and sends a signal back through to the muscle to contract a little bit. If we're pulling on it too far, we need to shorten it again. And that's one of the things, like when you're standing up, your body is constantly checking the length of our muscles, if there's any stretch there. And if we start to fall in one direction, we'll shorten up the muscle, bring it back to keep you upright, to keep you in line. So that's why we get tired or drunk or something like that, those reflexes get a little sloppy and we get a little bit wobbly. We don't react quite as fast as we should. Now, this is as slow as arc as you can. There's only 2 neurons involved, and your brain doesn't really acknowledge it, but it would in this case. We've got that stretch receptor there. We've got a split on our our axon here, and then this part goes up to the brain. I think that's what it says. It does H. Where is H? The reflexes are described in detail in the text. So we have an ascending neuron at the 2 synaptic loci, and then you have an interneuron here, and you're going back and you're tightening up that muscle, contracting that muscle to keep you upright. So this is the branching, is how we communicate to all different parts of the nervous system what's going on. So we've got that peripheral thing there. We have some sort of sensory input, in this case pain and receptors in the skin, and we have a reflex here that tells our brain muscle fibers, hey, pull away from that. That's not something we want to deal with. So we're talking about the patella reflex here. We strike the tendon. We got muscles on top of our thighs here, going through the kneecap, the patella, and then they're attaching to that lower limb. So if we contract this muscle up here, that's going to lift our legs up. So what we're going to do here when we strike with this hammer is we're going to put a little bit of pull on this. So if we've got pull on this and we're making it longer by pushing it in, we got to pull that muscle, make this long muscle longer. The the stretch receptor is going to say, if I'm pulling on that muscle, I need to contract it back. So when we hit that knee here, it's normal that this muscle should tighten up, this muscle should relax a little bit, and you kick your foot out when they tap on that tendon there, coming over the top. So you've got your one reflex arc here, going 1, 2, 3, and then the 4 over here is going to inhibit or relax that lower muscle so it doesn't fight the fixing or the adjustment of that upper muscle. You're also going to have these interneurons sending things up to the brain so you know what happened. Some different nerve pathways in our horse, front leg, back leg. We're not going to get into the details of individual nerves. So if we're thinking about the involuntary side of things, the motor involuntary, you're going to divide it into 2 different types of activity. You have the parasympathetic and the sympathetic. Parasympathetic tends to slow things down, calm things down. We think about it as rest and digest. So sleeping, good healthy gut function. The sympathetic tends to speed things up, pump things up. So we can think about sympathetic is going to come to our aid when we think about fight, flight, or freeze. So that's going to be kicked in. So we're thinking about the involuntary side of things. We're going to be in one state or the other. We're either going to be dominated by the parasympathetic or dominated by the sympathetic. We've got one state or the other at any given time. We need a balance of those throughout the day to make sure that we need a certain amount of parasympathetic to get the horse up, to get to eat, to stretch, to drink, to do things like that. And then we need the parasympathetic to slow things down, get a rest, lock things out there. So we're in one state or the other 24/7, 365. We talked about fight, flight, or freeze. There's actually 5 F's if we really get into it. The first reaction to a stressor, kicking in the sympathetic, we usually freeze. Then we start to fidget, we agitate, trying to figure out what to do next. And then the coordination kicks in and we will flight or run, possibly. If we can't run, we will try to fight. Cornered from flight, we're going to fight. And then if we're completely overwhelmed, that sympathetic system will kick in and cause us to faint. That's what the fainting goats do. Their parasympathetic or the sympathetic nervous system, involuntary nervous system is overstimulated, and they kind of jump right to the faint section, which is kind of difficult to deal with. So that's probably not a good thing. Fainting goats under stress would probably not last very long in the predator-prey world. So sympathetic chain ganglia, we've got a series of cell bodies, sometimes they run parallel. So we showed that as part of the reflex, those groups of cell bodies all together. And they're going to be organized in such a way that they're going to help run the parasympathetic, and sympathetic are going to help run the vital organs. And we'll show you the difference between the two. So again, we've got the parallel to the spinal cord, we got those sympathetic ganglia on either side. If we're looking at the involuntary parasympathetic, we've got the fight or flight, as two we talked about. There's going to be dominated by a neurotransmitter called norepinephrine. Those responses are going to be sympathetic. We're going to accelerate the heart. We're going to constrict the arteries, increase the peripheralization. We're going to dilate the bronchioles. We're going to open up the pupils. We're going to raise the hair on the back of our neck, on our arms. We're going to increase sweat. We're going to slow the gut, and we're going to contract the bladder and possibly relax the sphincter. So you're looking at things that all would promote that flight, that fight. You know, we're going to accelerate the heart. We're going to get things pumping. We're going to open up the bronchioles, open up the lungs. We're going to open up the pupils to see what we're dealing with. We're going to fight. We're going to take blood away from the gut and move it toward the muscles. Voiding the bladder, one less thing I have to move. If we're looking at the parasympathetic, rest and digest, we're going to slow down the heart. We're going to relax. We're going to open up the arteries, allow blood to flow. We're going to contract down the bronchioles. We don't need as much air going in and out. We don't need to hyperventilate. We're going to stimulate the tear glands. We're going to get the saliva flow. We're going to get the digestion in the gut going. We're going to relax the bladder. It's not going to feel as tight. We're not going to have that urge to go. So another diagram here talking about the sympathetic side of things versus the parasympathetic. How do they deal with different organisms? Or organs in the body. You got the parasympathetic effect and the sympathetic effect. So salivary glands under sympathetic, we have a very mucus secretion. We talk about people that are under stress, coughing, choking, tripping on their words, lying, they're coughing and things like that, because you got this viscous thing in here, as opposed to people that are relaxed, people that are not under stress will have a more serous secretion of saliva. So sympathetic is going to inhibit digestion. Parasympathetic is going to promote it. We have the follicles, we stand up, the hair stands up with a contraction. Muscles of the digestive tract are going to be inhibited by the sympathetic response. We're going to have less motility, we're going to slow things down because we're going to contract sphincters. Parasympathetic, rest and digest, we're going to increase the mobility of the gut and going to keep things digesting and processing. We're going to open up those sphincters so things can go through. Sympathetic, we're going to open up the lungs. Parasympathetic, we don't need it, so we'll contract those lungs. Bladder, we have some things there that are going to, in a sympathetic situation. I know of examples where I know a young lady's father scared the boyfriend so much that he pissed his pants. So losing the control of the bladder. Sympathetic's going to increase the heart rate. Parasympathetic's going to decrease. Our blood vessels, we got vasoconstriction, depending on where we are, or vasodilation in the parasympathetic state. So thinking about those voluntary versus involuntary, and the parasympathetic, the two divisions of the involuntary, the motor side. If we're looking how the motor system is set up, you've got the central nervous system as the bodies of the nuclei in the spinal cord or brain stem, and then the axon goes out to the skeletal muscle. It's one nerve that goes the entire distance. In the sympathetic, we have a short nerve first, the ganglia area, and then a long nerve second. In the parasympathetic, we're going to have a long nerve first and a short nerve second. So depending on what we want to pump up or what we want to rest and digest, we're going to do the two different pathways, and they're constructed differently. So all of our organs respond here. You've got the parasympathetic stimulation or sympathetic stimulation, parasympathetic stimulation to those organs. So here's another diagram showing us the same sort of architecture, but a slightly more information in this. Again, central nervous system, peripheral nervous system. We're dealing with the somatic motor responses. You got the body of the neuron is in the central nervous system. We've got one axon going out to the voluntary muscle. And if you're looking down here at the autonomic, we have the sympathetic and parasympathetic parts here. So sympathetic does short and then long to the various organs. So we've got a variety of different organs down here. Parasympathetic does long, then short. You've got here the sympathetic going to the adrenal medulla and releasing epinephrine. I think that's right. It might be the cortex. I can't remember which right off the top of my head. But epinephrine. So we're transitioning from neuron to nervous system to endocrine here. So you've got acetylcholine, norepinephrine as your transmitters, acetylcholine and acetylcholine as your parasympathetic, two transmitters, neurotransmitters. You've got a ganglion here, and then you've got a ganglion here. So this is very close to the spinal cord. This is farther away, usually at the cell itself. So here's another way of looking at the same thing. Again, we have a animal here. We have the parasympathetic illustrated on this side and the sympathetic illustrated on this side. So I believe this is supposed to be a cow if we look at the udder here, but to me this looks like a pig over here. But it really doesn't matter for our purposes when we're thinking about this animal. So we have the autonomic nervous system, and then we have the parasympathetic and the sympathetic adding or working on an array of organs here. So we got the lungs, the heart, the liver, the stomach. So this must be ruminant because you got the forestomach here, the intestines, then you got the kidney, bladder, and rectum. So we're looking at the sympathetic. We've got short then long. So our ganglion are right parallel to the spinal cord. And then we've got the parasympathetic. We've got long, then short. So, and then another difference between the parasympathetic and the sympathetic is where they come from. The parasympathetic comes out of the cervical vertebrae and the sacral vertebrae. Sympathetic comes out of the thoracic and the lumbar. So different sections are going to do different things. So these are going to close the lungs up. The sympathetic is going to open the lungs up. So sympathetic coming in this way, parasympathetic coming in that way. So different sections, and you can start to see that if I have a break, say right here in my spinal cord between my cervical and thoracic, I'll have parasympathetic control of a lot of organs, but I'm not going to have any sympathetic control of these organs. So you're going to have trouble balancing things out. The sympathetic and the parasympathetic need to balance out as we move forward. And with that spinal break, we can't have that balance. Another illustration, kind of the same thing, peripheral nervous system. You've got the blue here is going to illustrate the parasympathetic, illustrate again our stack of organs here. So medulla, here, midbrain, our parasympathetic are going to come out there and influence all of the organs here. And then we've got some here from the sacral part that are going to get down to the lower parts of the intestine, the kidney, the bladder, the genital organs there. And then we got the sympathetic, we've got the ganglion here parallel to the spinal cord, and then they're going to influence all those organs going there. So sympathetic, ganglion, parallel this there, and then we've got the parasympathetic from the cranial and sacral origins. So there's a lecture there. I haven't looked at it, but it was from previous note sets. If you're interested, take a look at it. I'm not going to spend any time on it, but it could help you study. So looking at the same thing again, we got the central nervous system, and going through here, the sympathetic is going to come out. You got ganglion there. So you're going to go short then long. And then we've got long then short associated with the parasympathetic. What they're going to do, how they're going to influence things. So cervical, sacral, thoracic, lumbar for the different ones there. So showing the different pathways in the horse. The parasympathetic is in yellow. So coming out, doing various parts there, and then coming out of the sacra, they're going to take care of kind of the organs in the back, whereas the sympathetic is coming out of the middle of the spine, the thoracic and the lumbar area, and it's going to go up, back. So all the organs will be balanced with a parasympathetic and sympathetic innervation, assuming we haven't damaged things there. So what you can think about is the similarities and differences between the parasympathetic and sympathetic nervous systems. Again, using the Venn diagram, if one circle is the sympathetic nervous system and one circle is the parasympathetic, what things do both systems have in common? And then what are exclusive to the sympathetic and what are exclusive to the parasympathetic. And we can talk about that on the other side. So differences between the thing there. So what's exclusive? How are they similar? I'm going to stop there. I ran longer on the other one. I'm going to stop here at 36 minutes. And we'll talk about how neurons work on the other side of the test. So that should be enough. I hope this is understandable. Bring your questions to week 11.